Nursing roles. Nurses make a huge impact in the type of care patients receive. I will be discussing two roles that are specially related to the care of obese patients, which are the bariatric nurse coordinator and the certified prenatal and postnatal fitness instructor. According to Thomas and Rickenbaugh, obesity is recognized as one of the most common chronic health problems in the United States. As you will learn in this presentation, obesity leads to many complications that require specialized care in the healthcare setting. This is why the University of California Davis Health System in Sacramento decided to implement the role of the bariatric nurse coordinator in their facility. Thomas and Rickenbaugh state that a coordinator is a nurse who has specialized competent knowledge in bariatric patient care and has the visionary and management skills to coordinate complete patient care throughout the healthcare setting. Their services are needed for a proper assessment of the patient, environment, and the patient needs, including mobility needs and safe patient handling, staff education and evaluation, and utilization of proper equipment. For example, patient beds have a capacity of 350 pounds. A patient weighing more than that would require a specialized bed. This implementation would not only improve patient safety for the patient, but also make them feel a lot more comfortable. Another example used in the article is the use of specific equipment to help lift and turn patients without any injury to the patient or the staff. A scenario presented was a patient weighing over 400 pounds being turned by a total of 8 members of the lift team. However, once the bariatric nurse was able to assess the patient and the situation, the coordinator educated the staff on the use of a friction reduction device to reduce the forces needed to simultaneously turn and slide the patient as needed for fitting and adjustment. By implementing this device, only 2 staff members were needed instead of using 8. The use of a bariatric nurse coordinator not only has improved patient outcomes but also reduced injuries of staff members. According to Thomas and Rickenbaugh, 1 year after UC Davis Health System implemented the program, there was a decrease of 77% of the number of patient handling claims within the patient care services. The next role that I will be discussing is the role of the certified prenatal and postnatal fitness instructor. Courtney Hines is a nurse in the neonatal ICU that decided to become a certified prenatal and postnatal fitness instructor to fight and prevent the incidence of preterm birth. According to Hines, 60% of women in the U.S. who become pregnant are overweight, and less than 30% of women maintain their gestational weight within the recommendations provided by the Institute of Medicine. Maternal obesity is the leading cause of maternal and neonatal morbidity during and after pregnancy. Maternal obesity also increases the risk for gestational diabetes, gestational hypertension, preeclampsia, antepartum stillbirth, cesarean section, increased birth weight and fetal growth, and preterm delivery. A certified prenatal and postnatal fitness instructor works with mothers before getting pregnant, during their pregnancy, and in the postpartum period. A client with normal pregnancy is able to participate in a moderate intensity exercise routine for at least 20 to 30 minutes per day, at least 3 days a week, which are recommendations provided by the American College of Obstetricians and Gynecologists. Hines states that exercise during pregnancy is healthy and has the potential to decrease the risk for excess gestational birth weight, postpartum weight, gestational diabetes, and preterm delivery.